It's one of the few things our cats do that drive us crazy, coughing up those hairballs. It's kind of gross and it's no fun to clean up. It sounds horrible. So let's get to the bottom of what we need to know about hairballs. Dr. Heather Loenser of the American Animal Hospital Association explains.
So a hairball, it's just that. It is a cat will vomit up something that's about the size of a dead mouse. Sometimes people will think it's a dead mouse, and inside you just find hair. You can't have the stomach actually completely fill up with hair and be a big, huge type of ball where you actually have to take out it surgically, but most of the time it's something little.
Now, where we might get into some problems is when it's not actually a hairball. We might get so used to the sound that we might think it's a hairball, but it might not be a hairball. And even if it is a hairball, how many hairballs are too many hairballs?
Well, if they're actually coughing, and a hairball comes out, and it's happening, once a week, once a month, I'm okay with that. Especially if there's no vomiting associated with it. If we're vomiting up hair and food, then there could be something like a mass or something like that stuck inside the stomach. But what I don't like seeing is cats that are coughing and people are writing it off as hairballs, but in retrospect, there's really no hairball coming out. So they're coughing. Owners think it is a hairball, nothing's there, and I'm worried about now for heart disease, lung disease, and actually heartworm disease. Cats tend to be forgotten that they could get heartworm disease, but they can. And one of the signs for that can be coughing. Also, if we have any other issues, like as we talked about, like a mass in the stomach that could be not allowing food or hair to get out, that should be evaluated too. And then asthma. Feline asthma is a real thing. So we can be allergic to cats, and cats can be allergic to the environment that they're in. And I would say asthma is probably the #1 cause I see for coughing cats. I live up in the Northeast where heartworm disease is certainly prevalent, but not as prevalent as it is someplace in the Southeast, or in other places in the country. So for me, coughing cats, I want to do x-rays of the lungs and see what they're looking like, and making sure that they're not having any difficulty breathing. It's not coughing from a hairball, but it's coughing because they're struggling to breathe.
Of course, whenever there's a change in your pet's behavior, if you have any questions at all as to whether something is normal or not, it's best to see your veterinarian. You can learn more at the American Animal Hospital Association website, aaha.org. I'm Steve Dale.